put myself on mute and let them take it from here. Take it away.
All right, that's me. Thanks. I'm Elisa. Nice to see you guys. Thank you for being here and learning a little bit more about public affairs and social media. So let's go ahead and get started. All right, you can do the next slide. That's not important. All right, and then I know that most of you guys know about this, but just a very quick and brief overview about Hearts for Home Care. We're an advocacy organization that is not exclusive to any one provider. It's not just for Bayada or anyone else. It is for everybody that's in the home care community. And one of our goals, and especially for me and Marissa, is to make sure that you can share your voice and share it effectively so that lawmakers can hear about why home care is important and why they ought to invest in it. All right, so just as a quick, like 30,000 foot view of everything, public affairs and social media is what Marissa and I are responsible for. And that involves earned media that you would see through traditional media sources, newspapers, working with
Hey, oh,
reporters.
I'm going to pause you for a second.
Mhm.
Hey, John, behind the scenes, is there an issue with the background or the others joining? I got a couple texts. Okay. Okay, yeah, I didn't know the ones that were joining through the link directly instead of there. Uh, that probably should have been a bigger number typically. That's why I was wondering if there's anything on the access or entry. Okay, thank you.
Should I keep going or do you want me to wait a little bit?
Yep. No, you're good. It'll be recorded.
All right, great. Okay, so like I was saying, public affairs encompasses traditional media that you would see through like TV reporters, newspapers, and all of that, and then social and digital media as well. So public affairs is really important. So as I know I say this, I've said this before, but when we as advocacy professionals share our stories with lawmakers and talk about the facts and figures, we can only get so much across to them. But when they really understand the importance of home care and how low funding creates challenges to access to care and all of that, then they really tend to understand home care better, and it really draws lawmakers into understanding why they need to support home care. So through your stories, when we receive your stories, they don't just go to us. What we try to do is we try to amplify them as much as we can through that earned media and social media. So reporters and the public need to understand what home care is, and legislators tend to pay attention to the stories that are happening in their communities. So what we do, me and Marissa and our partner, which is Regan Communications Group, we connect your voices and clients' voices with news outlets and social media. We also provide the data and the facts they need, whereas you guys are the ones that provide the human interest angle. Our duty is to lift up your voices, whereas your duty is to share your voices. Because you are the subject matter experts and the ones that are closest to the care and experiencing that care, you are the most important in this. Whereas Marissa and I are really, in a lot of ways, just coordinating and making sure that your voice is heard in the best way possible. Next slide. All right, and then essentially this is how it works. We think about, well, we all know what the problem is with home care, and that's that people struggle to access care. It's a struggle to make sure that we have enough caregivers in the workforce and that those caregivers are making a fair wage and that they're able to stay in this industry. So we find that when the problem in a lot of ways is the funding, right? And so when funding is low, we can't keep people in these roles and attract people to home care. And as a result, it's difficult for individuals with disabilities and their families to access that care. So that's the problem that's identified. And then we can share that all we want until we're blue in the face. But like I said before, it's the real stories that make an impact. And so, one, there's the problem. 2, there's people experiencing that problem, and 3, we share that, and then we back into the argument that there is a solution. Legislators need to see that there is a solution, and here's the data that backs it up. So you'll see on this slide, I'm not going to read it, but you guys can see, there's data out there that proves all of this. All we need to do is create that narrative, and that's the marriage of human interest, real voices, and then data and facts that back it up. Next slide. All right, and then this is where we need you guys. So like I said before, what we do is we coordinate and make sure that you can get your voices out there, your clients' voices out there, the nurses that you work with, their stories out there, and all of that. So when you see stories that showcase the issue and can showcase why there is a legislative solution, we would love to know about them. So we don't want to share stories where home care is really great and it's working perfectly and somebody has their missed shifts, all their shifts covered and all of that. We really want to share the stories that there's people that are experiencing this issue. A home health aide struggles to send her child to college. A nurse is unable to make the wages that she would make at a hospital, and therefore she goes back to working at a hospital. A client ends up going to a hospital because they couldn't access the care they needed to stay at home. Those are the kind of stories that we are interested in, because we want to share those stories, not because we think that they're perfect, but the news doesn't report on perfect stuff. The news reports on problems. And we want to showcase that these are problems, but they're solvable problems. And the answer to that problem is legislators making the right decisions to solve those problems. So what we need from you is to spot those stories and tell us what you're seeing. If your office, if you see that somebody can't access care, they see a revolving door of caregivers, and you see that as a pattern in your office, we want to see that data too. Missed shifts, staffing issues. What are you seeing in your office that is indicative of the problem at hand? And then not just that, and not just your stories, but we want you to tell others about Hearts for Home Care and about the value of sharing their stories too. Everybody's experience matters, and we want to hear those stories. Next slide. And then very important, something that I think we've overcome a lot at Hearts for Home Care is that I think that when Hearts for Home Care first started and we started engaging people in public affairs and sharing their stories, people were really nervous about the media. They see reporters as like these investigative journalists who are trying to dig for dirt and report on something that's bad. But as we know, home care is something that's not bad. Home care is something that once people really see it and understand it, they support it. And so something that I think is challenging in the home care field is that home care is invisible in many ways. It's behind the scenes and it's in people's homes. So people who are watching the 6 o'clock news aren't really thinking about it, and legislators may not be thinking about it as well. When we bring those issues to the forefront, what we find, we've worked with hundreds of reporters, and we know that when reporters see the stories that are out there, they're not out there to share these stories to like pull one over on home care. They're out there to share these stories to pressure legislators into solving this issue. So the media is not scary. The media and the reporters that we work with are on our side. They want to share your stories. They want to get it out there because they want people to know that there's a problem in home health care, and there's a problem that can be solved if legislators were to invest properly in this care and make sure that nurses, home health aides, and other caregivers can make the wages that they deserve. So it's all about flipping the script. It's not about highlighting something that makes it look like, Bayada or another provider is doing something wrong. It's all about sharing how the government needs to invest in these services. Next slide. And that's it for me. I'm going to turn it over to Marissa.
Thanks, Elisa. So just as we utilize earned media and stuff that you see in your newspapers or TV, we also utilize social media. And obviously, I think we can all agree here that we get a lot of our news, consume a lot of stories online as we're scrolling through Facebook, Instagram, Twitter, LinkedIn. And so back in about 2020, when COVID happened and the internet just burst open wide, we really started engaging engaging a lot more on social media, sharing these stories, building relationships with lawmakers, and just making sure that we have an online presence where, you all feel like you are being heard, that, we're communicating all of our legislative updates, and really empowering you all to see that, look, there's all these normal people that are sharing their stories, that are going through the same things as you, and having a community of like-minded individuals going through the same things not only helps make you feel empowered to get involved, but also helps legislators see that we are a growing movement, and we are important, and our voices are important, and we will hold them accountable on places that are public, like social media. So if you see in the bottom left-hand corner, there is a QR code there. If you scan that, that will take you to our Instagram page. Go and follow us on Instagram if you haven't done so already. We're also on Facebook and X, or Twitter. And then we will also be creating a LinkedIn here very soon. So follow us on all of those areas. But really, what we've seen just from our utilization of social media and the ever shifting change of how everybody consumes their news is that legislators really are watching, and we get so many more comments now than ever before from lawmakers saying, we tag them in posts, or we comment on their posts, and they say thank you so much for sharing this story and making this an issue that is coming to mind, and it really brings people together and helps our message spread a lot faster. So
I'm BT Tabor. I'm here at the South Carolina Steakhouse.
We're going to watch them in a second. So what really makes good content, right? I think we all have seen social media change over the years, and before it was somewhere that you just posted, shared different photos, or shared what you were doing. Now it's definitely become a place where people want to share real life stories, and they want to see positive impact stories, but they also want to see it in a very easy to digest, short manner. Unfortunately, social media has also made us all have very short attention spans. So, making sure that our content is short, is right to the point, has clear, bright, easy to see, understand photos and videos. We, just like us, legislators have very quick attention spans too, so they want to scroll quickly, understand what the message is, what the story is, and move on. So I'm going to share this one video in the middle as a really good example of this is a Pennsylvania mom and her son Gunner, who she shared this story on our website, which I'll show you where you can do that as well. And this is a perfect example of a really heartwarming, emotional video that gets right to the point, but also captivates the audience and makes people want to get involved and makes legislators want to pay attention.
My name is Lauren Hubbard, and this is my son Gunner, and we're from Lancaster, Pennsylvania. We are advocating for home health because Gunner is able to have a quality of life that he wouldn't be able to have otherwise because of the wonderful care he receives from his nurses at Bayada Pediatrics. Gunner is able to be at home, do school, get healthy whenever he has a little cold rather than going in the hospital, and that's so appreciated. Because of the nurses and their care, my husband and I are able to work and care for our other child and her needs, and we're just able to do our regular household duties and go to church and just live a somewhat normal life that we otherwise wouldn't be able to. So we are advocating for home health. Thank you.
So, like I said, short and to the point, she explained her family's story, how home health care helps their son and their whole family live a normal life. And it was in just her living room. It was something super simple, took her less than 2 minutes to record and do. These are the stories that we're looking for. And then this one on the right-hand side is from one of our Hearts for Home Care advocates who was at at one of our advocacy days in South Carolina. So let me...
I'm BT Tabor. I'm here at the South Carolina Steakhouse, and I'm here advocating for all of our caregivers, clinicians who are providing care for our wonderful clients in their home.
super short, simple, to the point. She told us why she was there and who she's advocating for, and it's just short, sweet snippets like these that that provide the best impact. All right, let me pause this.
I'm BT Tabor.
Hi, I'm Caroline Pearson.
So this is one of our Hearts for Home Care advocates, Caroline Pierce. I'm gonna play.
Hi, I'm Caroline Pearson. I'm a client service.
So you can record a story, share your story with us right on our website, and John is going to plop the link right there so you can click on it and you can quickly just record something right after we're done this call. But I want to share one more video about this video performed really well on social media. It had over just organically like 10,000 views. And it was just because she shared a very personal, heartwarming story about her grandmother and why she has inspired her to advocate. So I'm going to play it and then we will move on.
Hi, I'm Caroline Pearson. I'm a client services manager in our Bayonne Hickory Pediatrics office. I advocate for my mama Dot, who's 96 years young. Growing up, she always said she was a do-it-yourselfer, but at 96 years old, I'm thankful for the amazing caregivers she has that are able to help. I also advocate for the 44 medically fragile children with our office that rely on trustworthy and reliable home care to ensure that they're able to live their best lives at home and with their families.
So look, we just want you to be authentic, and we want you to share from your heart. It doesn't have to be difficult. It doesn't have to be scary. It doesn't have to be perfect or long. It just has to be authentically you. And that will come across on social media. That will come across with lawmakers. But we don't just share it on social media. We send these videos out through our advocacy software to lawmakers directly to their emails. We use them in so many different ways, but it's also just a way for others like you to go on our social media or go on our website and be like, wow, there are other people just like me who are sharing their stories. It can't be that hard. It can't be that hard to get involved, right? And so there's a few different options that you can get involved. You can record a video. You can also write to us about your home care story. That's also on our website. There's that option too if you don't feel comfortable with posting a video. Tag us on social media. If you utilize your social media already, your own personal social media, tag us on social media. Let us know what you're seeing in your communities that we might not be seeing. And then, like I said, just keep it simple. There's one message, one moment, your voice, and keep it authentically you. So this is just some others examples. I won't play all of these, but these are other people that have shared their stories. Everyone has a story to share about why home care matters to you, and we want to hear them. So just really quick, some video tips. Like I said, shorter the better, 45 seconds or shorter. Record vertically, so up and down like you're taking a selfie on your phone. This is the way most people consume their social media. This is the way legislators are going to consume it as well. And then obviously speak clearly and confidently. All of those videos that you saw were people that were really just talking to us like they were our friends. It was really low key, and it was they weren't scared or nervous or anything like that. And then obviously record in a brightly lit room. I will call out Mike Sokolowski. I used to call him out all the time when he would record his videos and send them to me because they were, in a darker room or in his basement. And although, ultimately we will take any story that you share with us, the brighter the room or being outside really helps to push that content and give us a better organic reach naturally. All right, and that is it. Elisa, you want to finish us off?
I think that's pretty much all I have, and I can turn it over to Mike. We're happy to answer questions. We're happy to expand on anything that you want to know more about, anything that you're confused about, or anything we didn't cover.
Yeah, thank you. And the best way for all of you that are watching this content, either on a social platform, YouTube, or watching the recording after the live presentation, you could always reach out to us. The easiest way, instead of giving all of our names and recordings, is Advocacy at heartsforhomecare.com. And if you reach out to us there, it'll be sent to the appropriate person so that they can respond to you, whether it be sharing your story, asking questions directly to a legislative ask in a state or on the federal level, whatever it may be. That way we're able to get it to the right person and answer your question as soon as possible. You could always reach out to us that way if you have ideas, if you have trainings you want to hear about, whatever it is, we are there for you. Look for updates in our newsletter and listen to the updates from Bliss every other week on the podcast. Thank you very much to Elisa and Marissa for going over this as we get ready for January, where, especially in the States, we will be making a great push to advocate on behalf of the clients and the field staff throughout June. And on a federal level, it is just ongoing all the time. That never stops. Thank you very much to everyone listening, and happy holidays.